I am joined now by Dr. Charles Johndro. He is the medical director of ground EMS at Hartford Hospital Emergency Department. Thank you so much for being with us.
My pleasure.
Now, we know that first responders are especially at risk for COVID-19. So how are you keeping them safe?
So during these times, we are requiring pre-hospital responders, providers to wear personal protective equipment on all responses during this COVID-19 crisis.
And you have enough PPE?
That's something that we're struggling with as an EMS community. We could always use more. Right now, we're trying to extend the PPE that we have to meet the need.
And are many patients coming into the hospital via ambulance or with EMS with COVID?
Yeah, so on a daily basis, we do have our share of COVID-19, both suspected and proven by testing patients, but we're also seeing our share of strokes, trauma patients, heart attack patients, as we usually do in the busy emergency department.
So how are you navigating that, a suspected COVID patient versus some other disease, of where they go and how you keep things sanitary that way?
So it starts with the 911 call. We have pre-hospital dispatch folks that are taking the caller their information and asking questions to try to determine whether they should be placed under investigation of COVID-19 or suspected. With that, we moved our triage area in the emergency department at Hartford Hospital a bit forward out into the ambulance bay to allow an extra layer of safety. And if a patient's not able to give us this information, we're treating all patients at this time as if they may be COVID positive, just to ensure the safety of all the providers, healthcare providers.
And if you do get a call that someone is in respiratory distress, obviously that might be a sign, but are they immediately tested as well when they're brought into the hospital?
So testing will be part of their medical workup once they reach the emergency department. But again, we're taking all precautions in these patients, especially with respiratory symptoms, GI symptoms, fever. We're treating those patients as if they may be COVID-19 positive and ensuring safety for all the healthcare providers.
Dr. Charles Johndro, thank you for being with us and sharing a little bit about how you're trying to keep your staff safe out there. We thank them.
My pleasure.